Hi, everyone. I am Kate King, and you are here with me on my interview series where I am interviewing various healing practitioners from different traditions to provide you with a wide array of healing resources for whatever life is serving you these days. So today, my interview is with massage therapist and trauma touch therapist Cassandra Lafong. I think you guys are going to love this. She's really sweet and inspiring, and we're going to talk about the mind body connection and just really dig into the way the mind and the body work together to provide a holistic sense of wellness for your entire system. Please subscribe to my channel and hit the little bell next to the subscription button so you can get notified for all of my videos and my new interview series. And I hope you enjoy. Hi, Cassandra. It's so nice to be meeting with you today. I'm really excited for our viewers to have this opportunity to learn from all of your healing wisdom. So maybe if you can just start it off by letting us know a little bit about you.
Thank you. I'm so happy to be here. My name is Cassandra. I have been in the industry for almost 12 years now. I got my aesthetics license when I was about 16. And then shortly after, got my associate's degree at the Colorado School of Healing Arts for massage work. So I have a ton of modalities under my belt. I've been working steadily since I graduated, and yeah, I'm really happy to be here. I just opened up my own practice in January, so yeah, that's where I'm at.
Congratulations on your practice. I know that you're going to help so many people.
Thank you.
So can we start out talking about the the mind body connection and just how that looks through a massage therapy lens?
Yeah, so a lot of times there's been like tons and tons of studies showing us that a lot of times our bodies can hang on to every type of emotion, sadness, fear, anger, even love, happiness, joy, all those types of things. And they've shown that certain parts of our bodies will actually connect to certain emotions. It's very fascinating. For instance, people who are carrying anger tend to have a lot of lower back problems. Sadness is usually found in the hips. When we experience love or happiness, our minds actually release oxytocin, which can lead our muscles to release and relax. So they have actually like a healing process on our muscles. Um, so it's really crazy. Like when you're stressed and stuff, we tend to tense up, but then our muscles just kind of let go when we're feeling any kind of positive, emotion through our lives, and it's pretty cool.
It is really cool. Do you notice anything different in the body when people have like a short-term kind of stressor versus a long period? Maybe anger is a consistent issue or maybe fear is consistent. Does that feel different than someone who just had like a burst of anger or fear in the body?
It doesn't necessarily feel different from my hands. However, it may feel different to the person receiving the massage or the treatment. I mean, there's so many different ways to release these emotions. Massage being one of them, physical activity being another, yoga. A lot of times people will experience some heavy emotions when practicing yoga. Some people oftentimes even cry. And that's totally normal because it's just you're literally twisting and manipulating those emotions out of your body. During massage, like I said, I wouldn't be able to tell if it's a long-term or short-term emotion.
Mhm.
But most people, when they come in, if they are experiencing something that maybe they've been hanging on to or they haven't been able to let go of, um, they oftentimes have what's called an SER, which is a somatic emotional release. When we release that muscle, sometimes the emotions go with it. So we find ourselves crying, or I've had instances where people are laughing, and it's just like an uncontrollable spark of emotion where you just, it just kind of happens. And it's totally normal. It can happen anywhere to anyone at any time during any of these services with any provider that really holds a safe space for their clients.
Hmm. Yeah, that sounds similar to some of the work that I do in therapy. I'm constantly referring people back to their body to notice the somatic experience that is attached with the emotion. So, for those of you viewers who don't understand the word somatic, that is basically just the sensations that you feel in your body. So, it could be a feeling of tightness or a sensation of temperature or like a nausea, things like that, that you don't have to attach a label or even an emotion to. It's just a felt experience in the body. Sometimes it's the body is not always congruent with the mind. So I feel like our mind can often play tricks on us or be attached to old patterns or narratives, but the body seems to always tell the truth. And so I know that I've had experiences before where I'm uncomfortable, but I want to be comfortable and I want to appear comfortable. And so my mind is like, put on a smile, you're happy, you're comfortable, but my chest is tight or my stomach feels nauseous. And so that would be an example of an incongruency between the mind and the body. And in that situation, what I work on in my personal practice is listening to the body and not just overriding it with the mind, but the wisdom of the body is saying, Kate, this is a no, or Kate, I need more support. This doesn't feel safe. So if we listen to those cues, I think it helps us to kind of connect, like you were saying, Cassandra, to have that sort of softening in the body where it can release and feel safe.
Yeah, absolutely. I mean, even when you think about like people who get nervous and they, describe it as butterflies, like you're having butterflies in your stomach, or, like the people who are super stressed and they just carry it all in their upper body. I mean, it's just so amazing how your body can really tell you like this person is not comfortable, or, this situation isn't comfortable, or
Mm-hmm.
maybe this is more stressful than I'm leading on to believe. So
Mm-hmm.
definitely listen to your body. And if you can, when you're experiencing something, ask yourself where you're feeling it. So, are you feeling it in your stomach? Maybe you are feeling it in your chest, or maybe you're starting to get a headache. Um, and those all lead to, how you're processing whatever situation you're going through at that very moment.
That's beautifully said. So, Cassandra, I know that you are a trauma touch massage therapist.
Mhm.
I'm not even completely sure exactly what that is, and I am sure a bunch of our viewers would love to hear about it. Can you talk about trauma touch therapy and how that differs from just regular massage therapy?
Yeah, so we took an extensive course. I did both trauma touch and cranial sacral therapy. Both are pretty similar. Cranial sacral is more, I'm working more with the body and the energy and stuff. Trauma touch, for those people who have gone through some serious stuff, I mean, we're talking domestic violence, rape, I mean, anything that is really, really aggressive to the body and the mind and the soul as a whole. Trauma touch is going to kind of help you process that. So, really, what we were trained on was holding that safe space and passing positive, safe energy through the body. A lot of times when people go through these traumatic events, is that they don't even want to be touched, and human touch is so so important. I mean, from babies, I mean, think about when you have a baby, the first thing they do is put that baby onto the mama for that touch. So when we go through these traumatic events and we don't even want to be touched anymore, that's where I come in, and I want to help people kind of progress back to that human interaction and that human touch between two people. Sometimes it's just kind of ripped from us. So what we do is we just go in and we take our time, and it may be that we're just sitting with each other and holding the safe space, or it may be that I'm coming in and just doing some compression. So we could maybe start by holding hands or doing some sort of compression where I'm maybe touching your shoulder or maybe just holding onto your feet and just creating a safe, warm environment for you to be you. And we just lead our way up. We just work our way into, finding what's comfortable and what's safe. And then eventually, hopefully, we can get you to maybe just a light touch massage. Um, Cranial sacral, that can be pretty incredible too for people who have been through trauma. That's only using about 3 grams of pressure to manipulate the skull and to manipulate the cerebral spinal fluid that runs between our skull and our sacrum, allowing us to kind of release and work through um, different things that have happened to us, whether it be physical, emotional, mental, things like that. So if one were to do trauma touch or cranial sacral for anybody, is to find someone who they feel safe with, whether it be me or somebody else. Just finding someone that really brings in that space and can hold that space for you is going to be so important in these types of therapies.
Trust is such an important aspect of the relationship when you're working with a healer of any kind.
Mm-hmm.
And it sounds like the both the craniosacral and the trauma touch therapy can be really safe ways to sort of enter into a long-term massage therapy relationship with a healer. Um, to get to that point that you were talking about in the beginning where the oxytocin can flow and the muscles can release and the mind can have some relief by the release of the body. So, my question for you around that is, when you're working with trauma, when you're working with deep emotions that are stored in the body, can you give me a sense of how, whether it's craniosacral or touch or massage, however you're doing this, how would you work together with someone who's also in psychotherapy and working actively on these issues and on their psyche?
I would say communication is super important during any type of therapy. You know, a lot of times we tend to kind of ignore things that we've gone through in our lives. And although we may think that we've partially healed from it or that we've moved past it or, whatever the case may be, sometimes during massage, when you're going through this and these deep emotions come up, we don't know how to handle it and we don't know how to get ourselves back through it, or that it's, something that we need to address again. So that's where, different therapists can come into play to help you talk about it, walk yourself through it, give you resources on how to, really recover. I can only do so much here in my scope of practice, and I can hold that safe space and I can make sure that, people are getting that peaceful and safe energy through their bodies. But I wouldn't know like how to really process that specific emotion for those people. And then that's where I would refer out to a psychotherapist to help them really walk through their journey.
Okay, so maybe that would look something like if somebody has one of those sort of spontaneous emotional reactions, um, following up with a psychotherapist about, saying, hey, my massage therapist was massaging my lower back and I suddenly got this burst of laughter. And so then exploring that with a psychotherapist, trying to find the origins of that or understanding more about the whole experience of that could be really complementary.
Oh
And
yeah.
I think it could go the reverse as well. If you're already in psychotherapy and you notice every time I talk about my dad, I get a headache, right? And
Mm-hmm.
then bringing that into session with you, that there's something going on in my neck, in my shoulders, my headspace, in my therapy work, and how allowing your massage therapy work to help release that. And it would be really interesting to track just within yourself. The more you talk about the hard things, the more you have touch and massage in your body, how do those massages and those conversations really unearth the hard things, but also help them to release and subside? I think it would be really interesting. And it's probably unique to different people how that looks.
Oh yeah, absolutely. I mean, we can definitely work hand in hand together for sure. And
Mhm.
I think, people can recover so much quicker when you have these different resources and these different people and providers in your life who can help you heal in different ways, you know? And I think that's 100% what they should do. I love hearing that stuff. It's kind of like our own little therapy room in there too, just two people in a room and
Mhm.
talking about what we need to do to help you heal.
Yeah, there's a lot of power in feeling seen and feeling heard. And I know that you do a really amazing job providing a safe space for that, even before you warm up your healing hands. Just being around you is very soothing. And I think that the felt sense of trust in your presence is really palpable.
Thank you. I appreciate that.
So, my last question for you today, Cassandra, is if somebody was not ready yet to maybe go to massage therapy or experience trauma touch or cranial sacral, how can people start this process of mind body connection and healing and sort of trying to release some of this from the body? How can people do some things at home that just might be a soft introduction?
I always like to say any sort of physical activity. A lot of people who are experiencing depression or anxiety tend to kind of stay and not do a whole lot and lose some motivation and stuff. But my best advice is to just get up and go. And even if it's only one time a week or, very seldomly, like just do it. A lot of times, especially with yoga, um, we're doing back bends that open our heart to the energy, and we're bending over and we're releasing our bodies that are going to hang on to like not being able to let go of things. The breathing in yoga is allowing us to heal on that more energetic level. So, I mean, even if you can get yourself into your living room and just pop on a YouTube video of some yoga or some type of healing exercise, I think is a great way to start. And it'll allow you to feel where exactly you're hanging on to this stuff, um, and kind of focus in and hone in on what the next step would be. But I would definitely start with physical activity for sure. There's also some really great books out there too. This one I read in school, um, and I really like this one. Me myself being through some of my own personal trauma, this one really kind of helped me see some things that I may not have seen before. Also, I really loved The Fourth and Fifth Agreement. I know that's a really popular book, but I have quotes from those books like written all over and hung all over my house and in my car and everything. I only have a Fifth Agreement here with me, but this one's by Don Miguel Rios.
Mm.
I really love that one. So, starting with physical activity, maybe just grabbing some books and seeing what happens after that.
I think that what makes it effective is how gentle you are in your approach to healing, that you really pace people and allow the body to feel completely safe before any really deep healing work is activated. And so I like the approach of gentle movement, and I appreciate that you talked about breath. I think just simply focusing and deepening the inhale and the exhale is a great way to start, and then reading things and starting to get interested. And the more education and knowledge we can take in, I think the more resourced and empowered we feel to take charge of our life. So those are excellent recommendations. Thank you.
People who have gone through trauma, they're not going to do it, and your body's not going to accept it until it is ready.
Mhm.
And I think just taking small steps is the best way to make that happen. And you would be surprised once you start, it's almost like you can't stop. Like you kind of, once you've opened one gate or one door, then that door leads to another door, that leads to another door. And then you find yourself back to a massage therapist or to a psychotherapist or exercising more than you ever thought you ever would in your life. So I would say just taking that first step, man, it's going to get you there.
Well, thank you so much. This has been really informative and very special. Would you like to just give us a brief shout out for your new business and just let us know where you are and kind of what you would like our customers to know?
Yeah, absolutely. So, the name of my business is called Inspire Beauty and Wellness. I'm practicing aesthetics, permanent makeup, waxing, and obviously massage. I'm located in Golden, Colorado. You guys can always go online to myinspirebeauty.com to view any of my services, and you're more than welcome to reach out to me at any time with any questions or concerns, and I'll always be here for you guys.
Well, thank you so much. It was lovely talking with you.
Thank you. I appreciate the opportunity.
Take care.